Hi, I'm Dr. Bud Holcomb, and this is another segment of Psychiatry for the People. I'm a board-certified psychiatrist who has practiced in Austin, Texas for the past 20 years. Last week, I mentioned that the symptom that most people suffer, regardless of their diagnosis, is anxiety. And so I'd like to go into more detail about recognition and treatment of anxiety in this video. Again, if Eskimos have 100 words for snow, we have many more for anxiety because it's that prevalent in our society. Fear, worry, stress, irritability, anger are all synonymous and words to describe anxiety/anger. I think it's important to point out that anger and fear are flip sides of the same emotion. When we stuff it or internalize it, we suffer anxiety or stress. When we open it up or act on it, it comes out as anger or acting out in angry or aggressive ways. And anger always destroys. As mental health providers, we hear all the time, "I had no idea how much anxiety I carried. I've just always been this way." However, we communicate by emotions, and we can feel it when we're around someone who is a stress ball or pissed off, and others can feel it in us. Anyone who has had some biology is aware that when we're scared or angry, we activate the sympathetic or the fight or flight nervous system. When we're scared, our bodies prepare to fight or flee. Blood is diverted from our massive GI system and vital organs to our heart and lungs and muscles. We can feel our heart rate pound, we start breathing fast, our blood pressure rises, and our muscles tense up. Everyone is familiar with having our stomach in knots or butterflies in our stomach. It's not unusual to vomit when we're very stressed, especially in children. This is highly adaptive when we need to flee danger or fight an enemy. However, in modern society, we're in a constant state of anxiety/anger, even though there's no immediate danger. Anxiety can be expressed in many different ways. Generalized anxiety disorder is defined as excessive worry or anxiety on most days, worrying about a number of events or activities. Anxiety can be expressed in social situations, and social anxiety is fear of being scrutinized by others. Many people will avoid public places or social situations out of social anxiety or fear of how they appear to others. Panic attacks occur when generalized anxiety gets so bad it crosses a threshold. Then there's a sudden onset of severe anxiety or dread or panic. Our heart starts pumping, we get short of breath, and we feel like we have to escape. A panic attack lasts for about 20 minutes. They're miserable and debilitating. Post-traumatic stress disorder is an anxiety disorder that's a response to catastrophic, overwhelming stress, such as occurs in combat or in an assault. It's important to point out that the anxiety or fear we carry now has always been there. When we were kids, if we didn't have caretakers who were good listeners, we had to have anxiety because nature is a scary place for a child if nobody's got your back. Knowing that anxiety/anger has always been there and is only getting stirred up in our current chapter helps us cope in our current life better. It's also important to point out that whenever we make it about things that are out of our control, the emotion we suffer is anxiety/anger. We have no control over what anybody else does or doesn't do. So when we make it about what anybody else does or doesn't do, the emotion we suffer is anxiety/anger. It's like drinking poison, hoping the other person gets sick. We also have no control over the future. Whenever we make it about what the future may or may not hold, something we have no control over, again, the emotion that we suffer is anxiety, fear, stress, anger. At the same time, the only thing that we do have control over is our emotions and what we do with them. That's why things that make us look inward, make it about ourselves, like meditation, deep breathing, exercise, are calming and reduce anxiety. We have to make it about ourselves because that's all we have access to or any control over. The way to treat anxiety is the same with all emotional disorders. First, you have to take away anything that's making it worse. And again, what we're referring to is alcohol and drugs of abuse. People use alcohol and recreational drugs often to self-medicate anxiety or stress. But everyone knows that alcohol and drugs of abuse make anxiety much worse. There is no such thing as a calm alcoholic or an addict. This is true for tobacco and too much caffeine as well. These are both stimulants and they make anxiety and insomnia worse. Alcohol and drugs are not the source of our lifelong anxiety, but you can't clean up a mess until you first turn off the broken pipe. We'll talk at length about alcoholism and addiction in future videos. After addressing anything that's making it worse, treatment should include as few pills as possible to reduce the symptoms. Because again, all that any medication does for any disorder is reduce the symptoms. It doesn't do anything to address it at the source. When it comes to anxiety/anger, the most effective medication are any of the serotonin medications that are usually called antidepressants. These medications are called antidepressants because the symptoms of anxiety and depression almost always occur hand in hand, and serotonin agents, or SSRIs or SSNRIs, are effective at reducing the symptoms of both. There's not a shred of evidence to suggest that any of the serotonin medications or SSRIs are better than the others. So it doesn't matter if it's Lexapro or Zoloft or Cymbalta. Because anxiety and depression are so common, there's about 20 different choices. In my opinion, the pharmaceutical industry is nothing but white-collar organized crime. There is very little reason these days to use newer name-brand medications. In current psychiatry, there is no evidence that generics are not just as effective, and they're a fraction of the cost. In 1963, Leo Sternbach, a Jewish immigrant from Nazi Germany, discovered diazepam, or Valium, as a medication to treat anxiety that was safer than barbiturates. From 1968 to 1982, Valium was the most prescribed medication in the United States. Valium and Xanax are benzodiazepine medications that are fast-acting, and that makes them highly addictive. In 1964, Leo Sternbach invented a better medication called clonazepam. The pharmaceutical industry was making so much money on Valium that they didn't release or market clonazepam until 1975. It remains controversial, but most psychiatrists prescribe clonazepam for anxiety. I am one who feels that clonazepam is a good choice in low doses to treat the many manifestations of anxiety. I recommend that it be used in a small dose in the morning, a small dose after work, and a larger dose for sleep. None of my patients ever take more than 2 milligrams a day, but clonazepam is highly effective. So I recommend a serotonin medication or an SSRI, such as Zoloft, Lexapro, Effexor XR, and a low dose several times a day of clonazepam. Stay away from Xanax and Valium. They are highly addictive and make anxiety far worse. Something that's very important to keep in mind when taking medication for anxiety is that people who have anxiety are going to have their anxiety stirred up by stuffing a new psychiatric medication into their bodies. This is very similar to the placebo effect, and the placebo effect is very powerful. I feel weird. I don't like this. I might lose control. This is making me crazy. That's not the medication. That's the anxiety that's already there that we're trying to treat. So the whole goal at first is just to tolerate the medication and not point our current anxiety at the medication. Then it should be very helpful with very few side effects. But people with anxiety are going to have anxiety over taking new medication. Then it is all about good therapy with a professional therapist to address it at the source. Again, I'm 55 years old, so I'm in chapter 55 of the Book of Bud. You can't open a book up in chapter 55 and make any sense out of what's going on. But when you read the whole story in good therapy, it makes perfect sense how come we feel and cope the ways that we do. To summarize, anxiety is the mother of all symptoms when it comes to emotional disorders. It can be recognized by a sense of being worried, angry, keyed up, and having insomnia. To treat anxiety, you must first take away anything that's making it worse, such as alcohol and drugs of abuse. I recommend serotonin medications such as SSRIs and low-dose clonazepam to reduce the symptoms for medication management, and working at least weekly with a professional psychotherapist to address it at the source. Next week, we'll focus on major depression and depressive disorders. Thanks for watching. Drinking poison, hoping the other person gets sick.